Welcome to the Royal Record here on GB News. First of all, just explain to me, the Princess of Wales has obviously had a horrific 6 months in terms of the huge amount of public pressure on her. There's clearly been a lot of trolling online. Some people still not believing it's the Princess of Wales, so really silly things. I mean, a lot of us have seen her in the flesh now because of Trooping the Colour. But what external pressures what kind of pressures can external factors have on a cancer patient?
I think a lot emotionally. It's a time of uncertainty. She's obviously had an operation for cancer. We're told that. We're asked not to speculate what it was. Somewhere in the abdomen, obviously, it was an abdominal operation. And then she's having preventive chemotherapy, usually given for 6 months. And the reason for preventive, we call it adjuvant chemotherapy. Adjuvant chemotherapy is given to reduce the risk of the disease coming back. So any cells that may have spread, there's nothing to see on the scans, but we think there's a risk of the disease coming back. We give adjuvant chemotherapy.
Sure. And in her statements on Friday, she said she has good days and bad days with her cancer treatments. Is that fairly common with cancer patients?
It's very common. So the actual day of the treatment's usually not too bad. The day after, you feel very tired, and then it's very unpredictable. Some people sail through it. I've had patients that go jogging, the second day they're out jogging in the park. Exactly. Others just feel collapsing in bed. And we tell everybody, don't push your body, just take it easy. There's no harm will come if you want to go to bed and have a nap or watch TV. Rather just let your body guide how you go. And it is very variable from patient to patient and from day to day, exactly as she describes.
Yes, and of course sorry, go on, Scott.
I was just going to say, you talk about the difference each patient has in responding to the treatment. We're seeing King Charles at the moment taking quite a different approach to returning to public life than Kate has done. He's obviously much more active and has undertaken many more engagements. But Camilla provided a health update on King Charles earlier this month where she said he's doing fine, but won't slow down and won't do what he's told. Do you think King Charles is possibly taking on too much?
No, I think everybody takes on what they feel they can cope with. And obviously, they've got different types of cancer, different types of treatment, and some treatments are much worse. I'd predict that Princess's treatment is quite arduous to have, and she's doing very well considering how arduous it is. Prince Charles is probably a bit lighter, the treatment, and therefore the side effects are less, and so he feels able to get back to it. The biggest problem for both of them is living with uncertainty. What's going to happen next? When they stop the chemotherapy, obviously they'll do blood tests, they'll do scans. What will these scans show? And that's the time of great emotional hardship for cancer patients.